I'm Mabel Jong. Thanks for joining me. In the World Healthcare Congress interview zone, I have Mark Fogel of Marcum. It's so great to have you here, Mark.
Thank you. Thanks for having me.
Give me an overview of what your work is like at Marcum.
Well, I'm the Chief Human Resource Officer at Marcum. We're a diversified financial services firm. We're best known for our accounting and advisory business. We've been in business since 1951, and we currently have 7 businesses across a spectrum of the financial industries: search, technology, investment banking, and all things that connect to financial services.
And right now you're focused very much so in the healthcare industry.
Absolutely. In fact, we're going into our renewal for our healthcare this year. This week, so the timing couldn't be better being here and talking about healthcare. And it's very important to us. It's our largest cost after employee compensation.
Now, what are your biggest concerns for your clients, your customers right now over the next 24 months as we see the healthcare landscape evolving?
Well, I think the main concern with affordable healthcare, or with Obamacare, as some people refer to it, is how it's going to affect cost and how it's going to affect businesses in terms of regulations or compliance. So from a cost basis, we all worry, are healthcare costs going to go up as a result of this legislation? And that's an unknown at this point. The secondary part, which is the compliance, those areas, we understand what the regulations are going to be. We know that we have to address certain concerns in our healthcare design and what we provide to our employees, and meeting what the government's asking us. For example, working 30 hours a week. If you work 30 hours a week as an employee going into 2014, you have to be provided healthcare. There are a lot of businesses out there that have part-time or flex-time employees, and how they're going to deal with that situation is being addressed right now. And then there are other areas with fines and fees, and it's really a jigsaw puzzle. Mm-hmm. But we're doing the best that we can, and we feel pretty confident about how we're positioned for the future.
Well, what sort of advice and guidance are you giving to clients right now who are concerned about the unknown?
Well, you know, I think that the intent of healthcare reform was to make sure that, from a society standpoint, that people are being covered, that individuals who haven't had access in the past have access. From a business standpoint, there's the issue of transparency. Now we're going to have healthcare exchanges, and employees are going to have information about healthcare that they haven't had in the past. Mm-hmm. We have to be willing and ready to address those factors. Also, from a cost standpoint, businesses recognize that the costs keep going up, and in some cases, individuals are spending more on healthcare than they're getting in their raises. Mm-hmm. That's a big concern. So how do we address that as a business, or how do businesses in general look at that? We've taken some proactive steps at Marcum. We're looking at doing something called defined contribution, where we set a base budget and you buy up to whatever the benefit levels are that you want. We're also looking at something called an HSA, mm-hmm. Which allows for flexibility and portability in your benefits. And for some of our younger employees, that's a really nice second option to choose. So being proactive, being aware of what's going on, understanding that as clear as we think the healthcare landscape is, it's really not that clear still, and just trying to do, to work through it.
Are employees concerned? Have they come to you with specific situations where they think that about the programs that they're enrolled in now?
Sure. We live in a world of immediacy, social media. Something happens 30 seconds later, it's out there, it's being tweeted. A plane crashes in the river in New York City, and the pictures are appearing on social media before the news crews get there. Right. So if you translate that into benefits, and the awareness that employees have today is much different than even 5 years ago. Mm-hmm. Employees are well educated. They know what other businesses are doing. They have concerns. They know that their dollar isn't going as far as it used to. Mm-hmm. They're concerned about the quality of care, not just the cost of care. So it's our role in HR and our role in our business to make sure that we're communicating and we're being honest and open with our employees. And I think we've taken some positive steps. We do monthly employee communications. Let our employees know what's going on, let them know how they can access some of our programs. One big change that you've seen in business in the last 3 or 4 years is wellness. Mm-hmm. And the idea of, instead of waiting for individuals to get sick and treating them, how do we get out in front of it? How do we have a healthier workforce? And what types of programs and services can businesses provide to allow individuals to jumpstart themselves in having a healthier lifestyle and reducing those costs and concerns? We all have a lot of stress. We have BlackBerries and phones that ring 24/7. So dealing with that and being proactive is really important, and I think employees, not just at our own firm, but at all firms, appreciate when companies are transparent.
Okay, well, we're going to leave it there, Mark. Thank you so much for stopping by.
Thank you. Have a great day.
You too. Well, thanks for watching. I'm Abel Jong.